Many people, when they receive diagnosis of Alzheimer or dementia, they are devastated, as well as their family also feel very devastated. My mom now has end-stage Alzheimer, and of course, like many people, I went through a period of grief to accept the fact that my pillar of strength and my best friend, that somebody I feel safe with, now is slowly losing her cognitive function. But then in the process of caring for my mother, I saw a new side of this illness. You see, a lot of things in life is a matter of perspective. If you look at how the Alzheimer or dementia progresses, their mind, the cognitive function or their brain function goes backwards, right? So slowly, they start to lose the function of their body and their mind, going back towards like a mind of a child. And then, in the end, during the end stage of Alzheimer, they are no more like a baby. Except that, of course, the only difference between an Alzheimer person and a baby is that the Alzheimer person is much larger, but they are capable of understanding language and communication. Most of them, at least, they still have that ability to communicate. But aside from that, don't you feel that it's just the same like a baby? And what does a baby remind us of? Baby reminds us of innocence, of happiness. People who have Alzheimer, dementia, and autistic kids, they are very sensitive to the moods and the feelings and the vibe of their caregivers. So if, let's say, we are able to shift our paradigm and look at it from we don't feel sad or we don't grieve about it because there's nothing much that can be done. But if we look at it from the point that they are going back to an age of innocence, maybe we would not, and we are nice and we do the best to care for them, and they feel that they are being loved and wanted, then they will change into very pleasant mood. Even if they are hostile, I've seen a lady who developed Alzheimer and she was hostile in the beginning stage. The caregiver was very patient and treated her very well. After a while, the protective barriers fall away. Because I would say that one merciful aspect of Alzheimer's disease is that it causes when the person ages backward, all the protective barrier, the coping mechanism that this person has built up to protect themselves against from trauma or perceived hurts, all fall away. So if, let's say, they were distrustful or they cannot find, they have difficulty taking rejection, means that they take things very personally, or they don't know how to process their emotions and all this, and then they try to deny and protect themselves, react in anger. This kind of coping ways that they do because they have gone through a lot, and most people with Alzheimer have gone through a lot, and they have a lot of mental toughness. But that kind of way of mental toughness produces maladaptive coping behaviors, a lot of suppression and denial that causes, I believe it causes the brain to shut down. That's why in the early stage, if it is for early stage Alzheimer, for a person that with early stage Alzheimer, when their mind is more flexible towards change, I would recommend getting help. Normally, underlying there's a depression. Treat that depression. Take medication if necessary to give the brain a rest. Then probably, if the depression is being treated, probably the Alzheimer would not progress, or it would not progress so fast. It would take much longer time. But back to this, now if this person already have Alzheimer, you can see the protective barriers falling away. And it's just like a baby. Babies are very sensitive to the mood and the environment. If the environment is nurturing, if they are being fed, they have enough food to eat, they don't feel hungry, they are clean, okay, you clean up and change their diapers and give them proper big bath, make sure they don't have bed sores, they feel very comfortable, they are actually very happy. Why people love babies so much is because of people love to see their innocence. There's a kind of innocent, kind of very special about babies. They will sleep in their cot the whole day and don't know what they're talking about, but they look happy and they look contented. When the Alzheimer person progresses and age towards the baby, that's how they will look, because that's how my mom looked most of the time also. Aside from sometimes she will feel a bit of discomfort and a bit of tiredness. Otherwise, most of the time she is very happy. She have this kind of she looks contented and happy. And ironically, this is the happiest. It seems that this is the happiest she is in her life. That she don't have anything, any sadness, any grief, any disappointment that holds and ties at her heart anymore. She forget all the memories. So if we look at it from that point and we understand that the reality for them with the Alzheimer, this is what that's happening, then we won't feel so much of sadness. For me, my aim now is that we actually, all we do is we fitted her with a nasogastric tube. I don't know why this is an issue in the West, but for a nasogastric tube, it allows a person to be fed, because most of the time for Alzheimer, their bodily function, their digestive function is working perfectly fine. Just that they cannot swallow, just the top part cannot swallow. So of course we can arrange that food to have a tube inserted. Insertion of the tube, of course, it will mean that you have to have a restraint for them, for their hands, as well as there will be some mucus built up, but with suction, and also the tube use a silicone one, it will be less mucus. So they'll become more bed bound, and we will probably have to look after them more. But then once they have enough of nutrition, they have enough of hydration, they'll become like, it's like a baby. If you don't feed them enough of food, right, if they're hungry, they'll cry all the time. So for the case of the Alzheimer, they won't cry, but they look very miserable. So if with enough food, you can see that there's a change. But you come to a point of invasive treatment. There are other ways of invasive thing we stop. I do not do for my mom. Like the doctor suspected that there is a growth in her throat. Probably it could be a reoccurring from the tonsil cancer she has 21 years ago. So in order to do a biopsy, they have to send her to ICU, and they have to really open up her throat and put in a large oxygen tube and do the biopsy. So we thought that, what's the point? Even if it's cancer, she's already too weak to go for any more treatment. So we do not go for that. We do not go for tracheostomy as well. When she had a lot of mucus initially, we don't go for tracheostomy because it will prevent her from communicating. Of course, now what she had, we actually don't know half the time what she's saying. She talks baby talk. But with the tracheostomy, she cannot. Most likely she won't be able to speak, and there's a risk of infection and a risk of her trying to meddle with the tracheostomy tube. So we also do not put for her. We do the oral suction instead. So there's a line drawn, and the nasogastric tube is just to give her food to make sure she's being sufficiently nourished, just like how we need to make sure babies are being fed. And now my mom, most of the time she's happy and she look happy and contented. And that's how I want it when the time comes when she leave the world. If she have to leave the world, right, when the time is up, at least she live knowing that she's being wanted, that unlike the programming that was the horrible childhood that my mom had, that made her feel inadequate for her entire life, those has been erased and wiped out. And she will bring with her the memory, the feeling, because most of the time, of course, Alzheimer and dementia patient, they cannot remember. They cannot remember things anymore, but they will always remember how you make them feel. And if they are happy all the time, when they leave this world, they will bring that feeling of happiness with them. In a way, if she didn't survive this, right, and she have left, she did not, and she died, passed earlier, it will be with a lot of agitation and there's a lot of protective barriers. But now these protective barriers have all melted away and she has gone back to innocence already. That's the pure innocence of a baby, of a child. So if we can look at it from that point of view, of course, we always, if we really love a person, we want that person to be happy, to be comfortable. So if we are able to, let us be able to accompany this person's journey and make them as comfortable and as happy as possible. Even though they are no longer our spouse, our parent, or our guardian, but now that this time is the time that they really, really need us the most. And if we can care for them, you can make sure that if we can put aside our grief and understand and see this illness from a different perspective, then we ourselves can also be happier as well. Okay, take care.